These are the best ways to fix this bunion pain at home. I see thousands of patients. This is the stuff that works best for me, and we're starting now. Bunions are so common. This is such a big problem. If you've got advanced arthritis, if you've got jagged bone, and it's crippling pain, yes, sometimes some people need surgery, but surgery is so marketed, just like a lot of medications, because a lot of hospital systems make a ton of money pitching these expensive surgeries. There's commercials with expensive hardware. And while these procedures can be amazing for some people, it's not as many people as you would think. These home remedies just work so much better for the vast amount of my patients. And I want to dispel the myth that you can't make these better. I would say the vast majority of people, their pain gets significantly better. They can walk better, they can stand better, they can go to work better, they can go on trips, they can hike that mountain that they always wanted to hike. These tips will do that. Will they heal bone and make you a teenager? I don't think anybody can guarantee that, not even a surgery. Bunion right here is this joint. It's your first metatarsal phalangeal joint. And what it does do is it bends out like this. So you can see right there, that angle changes. And a lot of the times your foot's flattening and the big toe joint's bending at the same time in the front here. It's the ankle collapsing, it's that big toe joint collapsing, and that puts a strain on tendons. You can see right here, there's tendons. This is called your flexor hallucis longus. So you can see right here, these tendons come off. And up here, there's one called your extensor hallucis longus. So when the ankle collapses, if your knee bends in, if your hip's off balance, if you're not walking perfectly straight, that tendon's gonna pull that big toe joint over and it's gonna be out of balance. That's the real trick to a bunion. If you can correct all these things practically, those tendons will hold it straight. Now, if you have advanced arthritis, it might not pop back into place perfectly, but this stuff just really does work. And is it permanent? It's kind of permanent. If you can get your hips, your knees, your feet straight, I have seen those toes really straighten. Will it reverse arthritis? It won't. Number 9, this is not a home remedy yet, but if you have scar tissue, a prior failed bunion surgery, if you ruptured or damaged something, I have had so much success with shockwave therapy, which is a sound-based therapy. Essentially, I put ultrasound gel on there and it just softens up that tight capsule, that tight ligament. And sometimes right away I can start moving that big toe joint, and before and after a 5-minute treatment, it just starts moving a lot better, a lot looser, and it makes it much more effective for what we're gonna do. Part of number 9 home remedy as well is laser therapy, something called the class 4 laser. This is newer technology, but I've had so much success with it. It basically uses red light to warm up the joint. Now, this is a more expensive FDA certified device that we have that really works well within a few moments. Really, these things have had so much success with me. I found myself doing less and less surgery because people's pain and bunion tenderness has just decreased so rapidly. If you're getting stuck, these things are worth trying. Number 8, proper foot hygiene. For a lot of people, they can have huge calluses, tightness, scar tissue, warts, calluses. That's something to evaluate because a lot of times people have big toe joint pain and it's really that thick, painful corn, that thick callus. Check that out. Just grab that with your fingers, see if there's hard, thick skin that feels like a rock or a pebble. You can soften that up, you can trim that out, and that could solve your problem completely. Number 7, maintaining a healthy weight. With more pressure, your foot collapses, your knee collapses, and your toe will bend out that way, creating a bunion. Weight and being fat are overrated. Fat itself hardly contributes, but it's really being too heavy compared to weak muscles. So it's a double whammy. What we're seeing in society today is people are getting weaker, especially men are having less testosterone and they're weighing more, they're more fat. 44% of America is obese right now, statistically in 2023, and they're far too weak. They're working from home, they're not really leaving the house, they're not getting enough protein, they're not exercising. It's really the lack of muscle strength to hold your knees, your hips, and your feet straight. Number 6, bone procedures. I'm not gonna get into it in this video, but there's so many great bunion procedures. You can work on the middle of the foot. This is the 3D bunions. This is called your Lisfranc or Lapidus procedure. You can work on the big toe joint. You can lengthen the Achilles tendon. I'm gonna give the pros, the cons, which ones are good, which ones have great 10-year satisfaction rates. I have those videos down below, and tips and tricks how to recover from procedures, including minimally invasive procedures that can heal up quicker. But the only time you'd really need bunion surgery is if you try this stuff and it's not working, or if you have advanced arthritis that's causing significant pain and issues for you. And number 5, soft tissue procedures. There are now minimally invasive procedures, especially for some of my older patients, where you could correct the foot, your hammer toes, your big toe joint, if they're curled, if it's a hammer toe. These are minimally invasive soft tissue procedures where you can essentially start walking right away. These are things called percutaneous tenotomies or plantar fasciotomies or Achilles tendon lengthenings in some cases. These can be very effective, especially for some of my diabetic patients that have a lot of pressure on their big toe joint with pre-ulcers and wounds. Number 4, padding and taping. If you have a turf toe, so if the bottom of the big toe joint, so see these two little bones called sesamoids, if they're hurting for you, you could essentially use tape to make a figure 8 type loop. I have a video on how to do that, but that can work really well. That prevents that toe from dislocating up and down. This can work really well. I would say for the bunion especially, if it's more than that turf toe pain, you want to use a gel pad or a spacer. And I'm going to go over whether those work or not next. Number 3, toe spacers and splints. Bunion splints, the ones you wear at nighttime, the ones you wear in your shoe, there's a lot of different types. There's hard plastic ones that hold your toe straight where you could actually crank it and adjust it. Those ones don't work. They work by holding your soft tissue, but even if you stretched your big toe joint straight, if your ankle's still collapsing, if your foot's still collapsing, if your knee's still collapsing, but it's not going to do anything for the flexor hallucis longus or the extensor hallucis longus. Now, especially with your knee, with your big toe joint, that's what makes the difference. So toe spacers and splints, they can really help, especially if you're wearing like barefoot shoes or inside a good running shoe. It will hold your toe straighter while you're walking, or business shoes or nice woman's dress shoes. That makes a big difference, but by itself, it will not reverse your big toe joint. And I see this on a lot of barefoot influencer videos or exercise videos. Yes, if you're exercising and you're strengthening your muscles and getting flexible, that does work, but it's not just the spacer. The spacer can help. It's a helping thing, but by itself, statistically, it has not shown to reverse bunions. The real trick is number 2, you want to get a biomechanical exam. And this is the real secret. And a lot of these barefoot influencers and a lot of these exercise influencers online, this is where they are getting it correct. If I look at somebody and I have them walk and their hips are unequal and their back's unequal and one knee's turning in and one's not, if your feet are flattening a little bit more on one side than the other, this is what's going to make your extensor tendons and your flexor tendons right here pull at a different angle. And I'm going to show you that in a second in a demonstration. If you can get your thigh muscles, your hamstrings, your calf muscles, your anterior tibial muscles, if you can assess them, get them stronger, get them more flexible, that's really the secret. And I go over a lot of those strengthening links down below. I show people how to do it. That's very effective. If you're having problems, get a biomechanical exam. This works so well with patients I see, and a bunion is just a byproduct of that. And this is where shoes come in. A great shoe will hold your foot and your ankle straight. Right now, people work from home. They're walking around barefoot, especially after COVID. If barefoot walking at home or barefoot shoes really did the trick, why wouldn't everybody be cured? The easiest thing to do in the world is to walk barefoot. You've probably tried it in the past, and you probably have a bunion. That's why you're watching the video. While barefoot walking's good, you want to already be flexible and relatively straight to get the benefits of that barefoot shoe. I go over that in a more detailed video below, but the real secret is you want to use good shoes and good insoles or potentially braces to hold your feet straight, to get used to walking straight. As you get used to walking straight, your hamstrings, your thighs, your calf muscles will adapt. And that's later when barefoot walking makes sense. If you're already straight, barefoot walking and barefoot shoes are amazing. But for a lot of people, it didn't work. That's why you're watching this video. Otherwise, just start walking barefoot. Why even watch this video? Because it's not working most likely. I'm a big fan of Ortho feet for older people especially. Ortho feet are the #1 ranked orthopedic shoe. And hey, I'm biased. I actually work with Ortho feet. They're a great company. I got them from my parents. I have a few Ortho feet shoes myself that I use. They make slippers. They make sandals. Those are linked down below. I have some discount codes. I have links for slippers that have arch supports built into them. Sandals that have arch supports built into them. And there's great shoes. Brooks, On, Asics, Saucony. I love all of these shoe brands. They can work extremely well. Just start wearing some of these good shoes. Go to a running shoe store, test them out. You're gonna see immediately how much better your bunion feels. And just make sure you have enough room for your big toe joint. And take a look at this shoe here. This is all mesh. This is the Brooks Beast right here. I love Brooks personally. This has an insole in here as well. The Brooks Beast, look at this. It has all mesh all around the front. If you're wearing like a leather shoe with stitching along the front, that's a big reason people have big toe joint, bunion, and hammer toe pain. Make sure it's soft mesh where your bunion and your hammer toe does not rub against these things. That right there can make most of your pain go away and help your bunion. Not only will it hold it straighter, but it'll stop it from rubbing. And the big secret, insoles. Over-the-counter insoles, check this out. They don't have to be expensive and they work almost immediately. When I push down on the ground, see how my foot collapses right there in the middle? You can see right there, it's collapsing and rolling inward. So it's rolling inward there. And what happens is when I put it on the insole, look at how straight, when I put it right there, look at how straight it sits relatively. It's not buckling in. Whereas right here, it's buckling in. Right here, hardly buckling in. As a result, the big toe joint right here, when I bend it up, it's pretty straight. But when I push this down right here, see how it bends up and in right there when the ankle collapses? That's a little bit exaggerated because I don't have a third hand to hold it, but that's what happens to your tendons. Over-the-counter insoles can be very affordable and they fit in almost all of the shoes I mentioned. Ortho feet, for example, comes with insoles already in them, but that changes the angle. And as 1 week, 2 weeks, 3 weeks go by, you get used to walking straighter. As 1 month, 2 months goes by, and now you did your biomechanical exam, your hamstrings are getting stronger, your thigh muscles, your calf muscles, now you start some stretching, you start some strengthening of your muscles, eventually you walk straighter and straighter and straighter. That's when things like barefoot shoes make sense. That's when things like just barefoot walking make sense. And your bunion pain should be better. Really, in like 2, 3, 4 weeks, you can get your bunion splint, your gel pad in there. You can do bunion taping at the same time as we showed in this guide. But in my experience, this almost always works for bunion pain. The only time it wouldn't is if you have advanced hallux rigidus, if you have some type of stress fracture, if you have like arthritis in your knee or your ankle or your hip, where you're just not straightening out because of those problems. That's when more advanced treatments or procedures might make sense. And if you're not getting better, check out my guide on bunion surgeries and more advanced treatments.